Hello everybody, Dr. Donna. We're going to keep this vitamin D education going, and we're going to talk about some blood work. So I know most of you are taking vitamin D already. Some of you take a couple hundred IUs, some of you take a couple thousand IUs, some of you have been prescribed like 50,000 IUs that you take once a week. Regardless, the most important thing is, what are your vitamin D levels? Look, there's going to be no harm in you taking a couple hundred to even a couple thousand for maintenance. However, that might be doing nothing, or kind of unlikely, but it might be too much. So before we take anything, we just kind of want to get an idea of what are your levels. Vitamin D, as you know, comes from a simple blood test. A lot of people get it with their physical every year. It's something that you can recommend that your doctor adds on there because it's important to know. If for some reason you already have had a physical or don't have one coming up for a really long time, don't worry, just ask us. We can send you to the lab. If I'm not mistaken, it's like $30-40 to go take it. You can go to any LabCorp and we'll have the results in a couple days. But when we get the results, we see a very big range with D. So your vitamin D, as soon as you hit 30, it's considered normal. But the upper range of that is 100. And so let's be super simple about this and let's end up in the middle. You don't want to be just at 30 because that's the lower end of the spectrum, and that's still not enough. It's good because there's people who hang in like the teens, of course. So 30, great place to start. However, let's get ourselves up to that 60, 70, even 80 range is a beautiful place to be, because that's when we're going to have the most rocking immune system on top of other phenomenal things that we're doing. Our heart health, our brain health, our memory, our bones, things are just going to flow better. So find out what your vitamin D levels are. Let's figure out a protocol to kind of push you towards that 60-ish range at minimum. And you know what? I'm not a fan of the once a weekers because I think it's something that your body should be working out in little doses, like all throughout the week. And then we always get the question of vitamin K. If you absolutely have zero salads and greens in your diet, then sure. Let's talk about maybe a vitamin K type supplement. Cruciferous Complex is one of our favorite ones from Standard Process. It's basically a whole lot of greens in one capsule for you to take. But if you're already eating that, I'd rather have you be getting your K with food. I'd love if you would get your D, naturally too, but most of us aren't spending a ton of time outdoors, soaking up that sun, not washing it off for 48 hours, really letting it absorb in. It's just not the reality of what we're doing. So let's review, get your blood work done, see what your levels are. Let's get your vitamin D levels up to that 60-ish range to start. Let's talk about dosage once we know where you are and where we get to go. And then eat a bunch of salads and you'll be good. All right, guys. See you tomorrow for some more. Oh, shameless plug. Vote Major for governor. You will see some recall stuff here. Got to get rid of Gruesome Newsom. All right. Bye.